Thank you. I see this is the time where your glucose level is getting down, and I see, if there's an automated, kind of science where I can click a button and you have your glucose up till, 90 milligram per deciliter. Anyway, I'm very pleased to be here to talk about, a success story in Pakistan, which is a collective wisdom after the USAID financing, Government of Pakistan. I'm very thankful, and of course, WHO and UNICEF, who have been actually working together to work out some of the science of automation in Pakistan. And before actually getting to what we have done, I would like to give you a very brief snapshot what Pakistan looks like actually from three major supply chain perspectives that I'm going to talk about, especially for tuberculosis, family planning supply chain, and vaccine, which has a large industry. Pakistan is a population of 196 million people. We have 40 million married women of reproductive age, and of those, 23 million women are at risk. And as of today, 3.5 million women will be pregnant in Pakistan. Now, looking at the routine immunization coverage, it's about 54%. I mean, despite the fact that Pakistan has been investing collectively with WHO, UNICEF, and other international stakeholders to strengthen EPI programs since 1978, but our routine immunization coverage is only 54%. So you can imagine, that a lot of investment has gone, and probably there was a need to look after things more, deeply. And then when you look at the family planning situation, the contraceptive prevalence rate is 26% for modern methods, and we are 5 provinces, 3 regions, 147 districts, a very nascent decentralization going on in Pakistan, with a fragmented, health systems and vertical programs, more than 16,000, health static facilities, more than 100,000 lady health workers, and then 7,000 community midwives. So this is a very complex political epidemiology operating in Pakistan. When you look at the financing side, you see that it is only 1% of the GDP that goes to health financing, and when you see how much of that 1% has been utilized, it is only 0.4%. Then looking at very closely at what the financing is around EPI, family planning, and TB supply chains, the EPI program in Pakistan is about $450 million per year. Predominantly, 95% of this money is all about vaccines, procurement. For TB, it's about $50 to $55 million for first-line drugs and MDR drugs. For family planning, Pakistan has been investing from 2001 to 2009 on the average $4 to $5 million per year until 2009, actually. And 2010 was a very difficult time for Pakistan because floods were there, and every money was actually going to internally displaced people and other reconstruction opportunities. So with this, you can see that there's a great opportunity to serve the people of Pakistan, and also from the perspective of the corporate business that this scale of public health supply chains require in terms of feeding requirements of product availability and data visibility. So in 2009, when we came here under USAID financing, it was basically a very difficult time, and this time was Pakistan was facing fiscal tightness. USAID was very kind to invest, starting with $2 million, a seed money, to work on major supply chains, warehouse rehabilitation, and other areas. But one of the most important focus was how we can upbring the situation of data visibility and product availability for family planning in Pakistan. And LMIS, Logistics Management Information System, for the population sector and health sector was the main area to look after. But I think the beauty of this investment in close collaboration with the government of Pakistan was that it came as a package of both software and hardware support. And for that reason, it proved to be a success in terms of ownership of the government of Pakistan and quickly making it part of the health systems in the country. Now, what this model is all about, and if I can take just 5 seconds, can I request my colleagues, volunteers from UNICEF, if you can have these brochures distributed, will be good. I'm sure I will not be able to talk about, very deeply about, what is going on, but these brochures will help you understand, and we can talk in the lunch break as well. So this logistics management information system, which was conceived from Bangladesh and then applied for the family planning supply chain. Family planning, as a matter of fact, has almost 150,000 transaction points of service delivery vis-a-vis public and private sector. And this system got a success. The Prime Minister of Pakistan actually, launched this, on 11th July 2011. And then, based on this success, the Global Fund came into it, and we developed the drug management information system for TB and MDR and lab equipment in Pakistan. And from there, a measles outbreak happened in 2012, and we were requested through USAID that we have to do something about visibility of the EPI supply chain in Pakistan. And Chris Wright, my very good colleague sitting here, came in June 2012 to see the landscape of how we can actually graduate EPI situation in Pakistan. So it's a story about a system that is owned by the government of Pakistan. It is housed within government of Pakistan. lmis.gov.pk. If you can Google, you will see that you can explore a lot of information there. But at the same time, I think the beauty is that all prevailing information systems, whether from UNICEF or WHO, have been actually integrated into one data code actually. It's LSS, it is VSSM, it is SDMS, or cold chain equipment from PATH, which UNICEF actually is promoting in the world. I mean, all these systems indicators have been actually put together onto one platform, which is being used by the government of Pakistan for all these three supply chains. Now we are living in an interdependent world where we learned many things from WHO. So guiding principles like supporting the individual, we actually identified our strategy was to make it as sustainable as possible. So we identified people from the public sector, from the government, and trained almost 100 master trainers so that they can actually trickle down the trainings down up to the last mile. And then they trained more than 2,000 LMIS operators, which actually report into this LMIS throughout the country. And then supporting organizations, the system is being reported by social marketing as well for family planning. So we engaged not only the public sector stakeholders, but also private sector like Maristov Society and social marketing, who actually report into one system, and government and people are able to see that what is the disaggregated contribution of different stakeholders vis-a-vis family planning, consumption or commodities and other supply chains. And then all relevant programs from the government, of course, from federal to provincial and district levels, which is all topmost and medium administrative levels, and then also changing by virtue of the policies, where distribution and storage things were changed for family planning commodities and other products. Now, from the leadership point of view, that how we have been able to harness the potential of the workforce in Pakistan. It was a multidimensional approach where we were not only able to engage people who are LMIS operators from these three supply chains, but we were also able to engage people like, advisors to chief minister, ministers at the national level who are interacting with the prime minister to make sure that, we bring importance to these public health supply chains, which somehow are not getting that importance. So our strategy was to engage people from multi-dimensional areas, and then making sure that we are able to develop a critical mass from people who are close to the heart of data reporting actually. And then a lot of documentation and policy, guidance from the government. So together with WHO, UNICEF, and UNFPA, we worked with the government of Pakistan to see what logistics, curriculums and documentation is required in terms of implementing the system down at the LMIS operators level, which is at the BHU, THQ, the health post level actually. So we developed all these, and you will note that. All this documentation is on the Government of Pakistan website, for the purpose of, ownership, but also that, despite the fact that money is coming from USAID, but the positioning is Government of Pakistan. So there's a lot of ownership in terms of, how we are positioning all this support in Pakistan, making sure that Government of Pakistan is owning it. And then most important thing that we have been able to demonstrate is engaging the public workforce in making sure that there is a mechanism for supportive supervision at the ground level, actually. So we engaged, a co-joint monitoring where Government of Pakistan people and people from the project actually go into the field. They have, standardized, operating checklists, which they tend to fill out from the field based on LQS methodology. Yeah. So this slide is basically showing I mean, the streams of different, workforce. I mean, though these three supply chains have been integrated onto one interface, but they are operating vertically. So we identified people relevant to different supply chains, and the cost, as you can see, I mean, this 4 or 5 years effort, training more than 2,200 people, is almost $460 per person that we have trained to. So it's not that costly, actually, and investing is certainly making a difference. And now, I mean, all these outcomes from the data reporting that Government of Pakistan has done is basically showing you, that in February 2013, the reporting rate was 41 for the Department of Health, actually. And in February 2014, with this training of workforce, it raised up to 80%. And likewise, for Lady Health Workers Program, which is a fleet of almost 100,000 lady health workers across Pakistan, the reporting rate for family planning was 43 in February 2013, and the next year it raised up to 84%. So what I'm trying here is basically investing on workforce at the lowest level does make a difference in terms of improving reporting rates and acquisition of data and making sure that data is used for policy, management, and operational purposes. This system, the VLMIs, which has just been launched in January and then released to in September 2014, you can see that reporting rate has gone up till 88%, and I heard for the last month it was 89%. So all these things are actually making a difference. I mean, this is my second last slide, and the lesson is that investing in the workforce, building the capacity does work, actually. It improves workforce knowledge, it improves reporting rate and greater data visibility, which can be used for many purposes, from policy, procurement, and operational management, and of course, better supply planning and distribution. And then my conclusion is that, of course, this investing, whether it is task shifting, whether you are developing new cadres, in our case, we are task shifting, actually. I mean, we are using the existing potential which is present in Pakistan in terms of all these 2,200 people who have been trained from public sector and private sector, makes the difference in terms of reporting rates improvement, and also that data are used for policy functions like domestic financing. You will be very pleased to know that with this 5 years investment of USAID, the Government of Pakistan has allocated $75 million for family planning, commodity procurement, and that is going on. And so that's a very good co-joint monitoring financing in terms of making sure that things work. And globally, as I said, that this VLMIS or CLMIS or TBDMIS is basically, three supply chains managed to be on one platform. It's basically not something new. It is basically coming from WHO, UNICEF, and UNFPA global experience, and we have put all those indicators together, applied GIS, and made sure that it works for the Government of Pakistan. And my message is, because this is a organically one code system, it is an open source LMIS, and it can be very easily used as an open source LMIS for the regional countries to be replicated. And these discussions are actually happening next week in Washington to see, and also in Istanbul, in the week of 10th of November, that how are we looking at all these examples to see a possibility of replication in many other parts of the world. Thank you very much.